Good evening and welcome to another edition of Borno Health Update. I'm your host, Ibrahim Amarawa, here to shed light on the remarkable stride being made in our healthcare sector under Governor Zulum's visionary leadership. Today, we focus on the transformative efforts spearheaded by Professor Baba Malam Gana, Commissioner of Health and Human Services, who is driving innovations and resilience in our healthcare system. One plan, one purpose, better health for Borno. This is what the State Ministry of Health, under the leadership of Professor Baba Malam Gana, is championing, focusing on utilizing a holistic approach to transform the narrative concerning various healthcare sectors within the state. The Borno State Ministry of Health, in collaboration with the sector-wide approach SWAB program for improving national health sector, has organized a 4-day training workshop for health managers in the state to develop 2026 Annual Operation Plan AOP. The 4-day training workshop took place at the Pinnacle Hotel, has directors of planning, research, and statistics from the ministry and its agencies, as well as top health managers in the state. While explaining the purpose during the opening ceremony of the meeting, the Honorable Commissioner for Health, Professor Baba Malam Gana, emphasized why such training is essential to change the circumstances the state finds itself regarding to numerous challenges. This includes the maternal mortality rate, malaria, and others.
This meeting is very important. This meeting is crucial, especially for us in this state. This is because our indices, not only as a state, but as a country, Nigeria, is really skewed. Our medical indices. Nigeria is amongst the first 3 countries in terms of economy in Africa. However, our indices, medical indices, are at the bottom. Unfortunately, we are leading from the bottom, where countries like Chad, Southern Sudan have now surpassed us in terms of medical indices. Examples include maternal mortality. Nigeria leads the world. Nigeria contributes 30% of maternal death in the world. So therefore, every 1 in 3, 1 in 4 women that dies in the world related to pregnancy is from Nigeria. As we speak, every 7 minutes, a woman dies in Nigeria through pregnancy related. And in terms of neonatal or newborn death, Nigeria stands as second only to India. In terms of malaria, Nigeria is leading the world. In terms of malarial death, about 4,000 children die every week from malaria in Nigeria. If you take HIV, Nigeria is only second to South Africa, which is leading. If you take tuberculosis, Nigeria is number 5 or 6 in the world. So the list goes on. And that is the more reason why His Excellency, the President of Nigeria, Senator Bola Ahmed Tinubu, agreed with the 36 plus 1 governors of Nigeria to sign on a compact in Abuja, which I witnessed myself, plus all the health commissioners, where all the governors signed that we will now look at health in a different perspective. This is the introduction of the sector-wide approach in December 2023 at the Villa, Asorok Villa in Abuja. And the whole aim of sector-wide approach is to transform all these poor indices that I've enumerated. We have to do something about it, otherwise, by the year 2050, when Nigeria becomes the third most populous country in the world, after India and China, the situation will be catastrophic. And that is why sector-wide approach was organized, where all the partners and the federal government will put money in a basket so that we can have one plan and one budget and one results, so that things that I've enumerated can be changed.
So Baba Malam Gana, while emphasizing the importance of such workshop and the need for all and sundry to come together and face the serious problem affecting the state's health sector, issued an order that all DPRS must ensure they attended entire days of this workshop. He added that planning is crucial in the sector because if you don't plan, you plan to fail.
If you don't plan, then you plan to fail. And that is why we're having this meeting today. Let me direct all the directors of planning, research, statistics, Ministry of Health, and all the agencies must remain here and attend the full program. This is an order. You have to be part and parcel of this throughout. There's no reason why any of the DPRS from the agencies would decide to go away from this meeting. You must remain, especially we're expecting Federal Ministry of Health to participate tomorrow or for the rest of the days, and therefore all our prospective DPRSs must be around to understand the planning of what we're doing, so that we are not only planning for 2026 annual operation plan, but also how to implement the current 2025. So therefore, they must stay and look at and study and participate in full. This program SWAP is different from the previous plans or programs of the federal government, and the DPRS, Alhaji Al-Kali, has clearly stated that this program is P for R, performance for results, and they are disbursement linked. So therefore, unlike previous programs, you have to perform before you get reimbursement. And that's where the planning departments come in. We have to work assiduously together with the agencies, and that is why the agencies, GPRSs, must be digitized straight away, so that anytime we need information, it will be made available without any delays. So once we do this, we can be able to key into the federal government programs at all times. And what that means is that all the agencies will be working together in this aspect. Slowly but surely, we will begin to digitize our systems. As a matter of fact, in the Challenge Fund, that the maiden edition that we won, one of the very red areas in the results, even though we won that time, was about data. So our data is weak, our data is poor, and the federal government felt that it's not just Borno State, but it's all over the country. In this state, we have already commenced the digitization of our healthcare institutions, For example, the 1,000 estate here in Maiduguri, we have digitized the primary health care there, and it's remarkable how the nurses, midwives, and other staff in those facilities appreciated what it means to have a digitized system. We have also commenced the digitization, nearly completed digitization of the state specialist hospitals, which is like 5 primary health cares put together in terms of the amount of all the equipment you need to make it digitized. But nonetheless, with the help of one of the partners, UNICEF, it's almost done, and we have to extend it to all other facilities. And this will ensure that the data we're capturing are quite high quality data.
That was Commissioner of Health, Professor Baba Malam Gana. Earlier, the Permanent Secretary, Ministry of Health, Dr. Shatima Maina Muhammad, and the Director, Health Planning, urged the participants to pay attention in order to come out with a comprehensive annual operation plan for the year 2026, and applauded Professor Baba Malangana for this wonderful.
Great joy to be part of this event today, which is my schedule of duty as a public servant, a clear manifestation on the government desire for improvement in the transformational processes of the health sector in our dear state. Let us appreciate our Honorable Commissioner, Professor Malam Gana, for initiating and organizing this training workshop, which I believe reflect the importance that is attached to the process of health sector transformation. This training workshop is not an optional, rather it is professional imperative. I urge all participants with all seriousness to take advantage of the time you are here making to take judicious use and utilize your opportunity as one of the participants here today. You are the guidance of public and backbone of Borno State health sector reformation. Excellence is no longer a choice, but a duty. By not doing so, you are doing disservice to your offices. Let us not tolerate stagnation, negligence, or misuse of systems that are mean for transformation, transparency, and accountability in health sector. Let us use this training workshop to reignite our passion, reinforce our discipline, recommit ourselves to building health management system that is worthy of our people's trust.
In an interview, the Honorable Commissioner speaks about the expected results of the workshop and its impact on the well-being of the people of the state.
This SWAP, which stands for Sector-Wide Approach Program, that's being cascaded in terms of training of our staff in Borno State, is absolutely crucial for our dear state. As an example, Borno State is number 3 in Nigeria in terms of maternal mortality and newborn mortality. And therefore, if we key into this program, the appropriate funds will be made available to the people of Borno State so that we can be able to engage even more, for example, midwives and more staff, and engage and more equipment, and they would help us in even getting some more drugs so that we can be able to mitigate this example of very high maternal mortality burden in the state. Expected result is to change the rather very awesome medical indices in the state. It's not just Borno State, but actually Nigeria as a whole. For example, the malaria death in Nigeria is the highest in the world. Maternal mortality is the highest in the world. Newborn mortality is second highest to India in the world. So all these indices that has to be changed to show that our healthcare system is working and looking after the people of not only Borno State but Nigeria. These are the outcomes or assessment of health systems are based on using these indices, and therefore we are determined in Borno State to ensure that these indices, especially maternal mortality, is crushed through the swap as well as through His Excellency's implementation of the safer bundle of birth care within Borno State.
Severe acute malnutrition is a major concern, particularly afflicting Borno State due to the 16 years of famine and insurgency. However, thanks to collaborative efforts between UNICEF and the Borno State government and other partners, progress now is being made in tackling this problem. This week, UNICEF handed over 2,252 cartons of life-saving nutrition commodities, namely RUTF, to the Borno State government under the Ministry of Health. This was funded by the Child Nutrition Fund. While delivering his speech, the Honorable Commissioner for Health, Professor Baba Malamgana, stated that malnutrition is a significant problem, especially in the context of insurgency. Nevertheless, with the support of UNICEF and other organizations, the government is striving to eliminate it. However, he appealed for UNICEF's continuous support to bolster the state government's program aimed at initiating the production of Tom Brown's locally produced nutrition children food supplement. This is to ensure sustainability of this aspect of addressing malnutrition among children in Borno State.
The issue of malnutrition is a big problem, not just in Borno State, but Northeast and Nigeria in general. For example, in Northeast alone, we have over 2 million children who are suffering from malnutrition, out of which 500,000 or 500,000 are severely acute malnutrition. So therefore, it is apt for any government, especially of Borno State, to take actions against this malnutrition. We need to look into malnutrition and realize that the most important critical people affected are children under 5 and women who are pregnant and lactating. Children under 5, especially in the first 1,000 days of their life, is very critical. If they ever suffer from malnutrition, they may have the results, they will end up with mental problems. So much so that they may not be like you and I, who have been to university, etc. They will be struggling. And therefore, we have to take this into cognizance. The government of Borno State, under the leadership of Professor Babagana Omarazulum, in collaboration with the federal government, as elaborated by the Permanent Secretary of Budget, have been working assiduously to see that the issue of malnutrition is tackled head on. I'd like to thank UNICEF for their dedication and always coming to our aid, always with us discussing and keying in to the programs of Borno State. Thank you, UNICEF, for this. I'd like to also recognize and appreciate Gates Foundation, even though they are not here today, but Gates is also funding this program. And therefore, we're immensely grateful to Gates for this, looking after our malnourished children. There are also, of course, others who are involved in this. Whilst appreciating UNICEF, I would like to highlight that we are like Oliver Twist. we always ask for more. The Borno state government has got plans in terms of sustainable or sustainability of this program. We don't want to be dishing out RUTF all the time, and therefore we look into areas of collaboration with partners. Of course, Professor Arab has enumerated. To sum up, conflict, climate change, and cultural barriers are the main causes of malnutrition in northern Nigeria. Conflict, which included insurgency, which we've had for about 16 years. Way forward, ladies and gentlemen, is to collaborate with partners to see that this RUTF that we are about to hand over or to be handed over to us today could actually be produced in Borno State. This is the way forward for us. We don't want to be buying this from abroad or buying them from somewhere else, Lagos or whatever. Why not produce this therapeutic food stuff which we can easily produce? We have our own called Tom Brown, which we can actually upscale it at industrial level. So I would like to appeal to UNICEF and other partners such as Gates Foundation to look into this matter. We have made arrangements. As a matter of fact, we have had an important meeting at the UN House in Abuja, and which the Executive Secretary, Primary Healthcare Board has also attended, where all the arms of UN attended with a view of championing and assisting Borno State in this quest to have production of RUTF locally.
Earlier, the Executive Secretary of the Borno State Primary Healthcare Development Board and representatives of UNICEF explained the kind of effects that severe acute malnutrition has on young children and the community. They also praised the governor of the state, Professor Babagana Umara Zulum, for the way he prioritized healthcare, which led to a major success in eradicating this problem that affects Borno State.
The problem of malnutrition, childhood malnutrition in this region, in the states, is not far-fetched. We have the problem of insecurity. Here we are, our farmers don't get full access to the farm, and therefore we are left with food insecurity. Again, here we are in the States, we are actually addressing the issue of childhood malnutrition here and the extreme end of the severe acute malnutrition, where these commodities that are provided by both in collaboration of the state government with our partners, particularly UNICEF. Importantly here to us, first and foremost, we must appreciate the leadership of His Excellency Professor Babagana Umara Zulum in supporting all 100% of all our needs in the primary health care. Particularly and importantly here, we have what is called the Child Health Fund. And it is actually part of the government to contribute the counterpart funding. And government has actually released all the 100 million naira counterpart funding. And of course, the other aspect is taken care of by the UNICEF. And to that, we must actually extend our appreciation to His Excellency for prompt payment of this counterpart funding.
I want to say this is a historic moment It's the first time this is happening, what we are witnessing today in the state. We are here to launch or to hand over the Child Nutrition Fund. Just to give you a quick overview, it's existing initiative happening around the world with UNICEF and donors, where domestic funding is provided by the government, and then that is matched 100% by the funds provided to UNICEF. So Borno State has joined the line with other states in living this exemplary, leadership in our joint efforts to combat child malnutrition in Borno State. With sincere appreciation for the unwavering leadership and collaboration of the State Ministry of Health, the State Primary Health Care Board, and other dignitaries or states that are helping in this process, I'm pleased to formally hand over the consignment of over 2,000 cartons of ready-to-use RETF procured through the Child Nutrition Fund for the treatment of children suffering from severe acute malnutrition. Let me just give you an example what the state has done. In the past 9 years, for the first time, we are seeing a decline in the spike of children with severe acute malnutrition with medical complications for the first time. This was done with the leadership of the Primary Health Care Board, where we intervene in the first quarter so that we break the cycle of the lean season. When you look at the data, you compare last year and the year before, the numbers we have this year is much less. By June last year, we'll be on our phones 24 hours round the clock looking for places to find beds and find hospitals, because there are excess cases and overflowing cases in hospitals. This year is not the case. We hope this will continue. So the cycle, I'm not saying malnutrition has finished. I'm just saying we are making headway. At this juncture, I want to thank you all. Thanks to our governor, Honorable Commissioner of Health, your office has been so open to us. Sometimes I feel like we are so privileged to have you and the kind of passion you have.
Climax of the event was the official handing over of life-saving nutrition commodities to the Honorable Commissioner for Health by the head of nutrition of the UNICEF. For joining us. Stay tuned for next week's update, where we will explore more innovations in the healthcare sector. This is Ibrahim Amarawa, reminding you health is wealth and Borno is on the rise.